Welcome back to the Winner's Circle, everybody. I am here today with Brandon. He is from Starkey, and he is another big Innovation Award winner, and they are taking over the hearing aid market with some new innovations, especially around AI, and we are so excited to talk to Brandon. So Brandon, welcome to the Winner's Circle, and congratulations.
Thank you, Russ. I enjoy what I do, and as they say, when you enjoy what you do, you don't work a day in your life. And we are changing things and really helping a lot of people with how to think about hearing health and hearing technology. So I'm honored to be here and talk with you today, and let's have some fun.
Yeah. So before we do anything, let's just step back for a second. Give us a little bit of an introduction on you and about Starkey. You guys have been in the hearing game forever, I think. I think Adam first lost his hearing according to Eve, and you guys were there, or something along those lines. Give us a little bit of background.
Well, Starkey, there's 5 hearing aid companies in the world. We are the only U.S. owned and operated. We're privately held. We were started in 1967 by our owner, founder, and who's still actively working with patients and stuff in the company now. Started in the basement of his home. One of those true entrepreneurial American success stories. And as I frame up Starkey, we're legacy built and future driven. We've learned from the past. We've pioneered. We've done a lot of things that were first in the hearing industry, and then we've been building on it. And Starkey today is, we operate in 29 countries. We have close to 6,000 employees. We sell and provide products to hearing professionals around the world, and it's a great business because, as I kind of frame it up, we're in the caring technology, and we get to help people hear better, live better. I started in 1994. I was 19, and it was a summer intern job, and started in the repair lab and just the entry level. I was going to go to my second year at the University of Minnesota, and I said, well, I kind of like this, So they kind of talked to me if I wanted to extend a couple months, and I could go to apply the next semester. And 31 skip years later, here I am.
There you are in the boardroom at the CEO's table, right? It is a magical story. It's a great American company, great American story. From the mailroom, repair room, right up to the CEO's chairs. How did that hands-on kind of experience really kind of shape your career there?
I always had a good work ethic and team player, in sports and growing up. And, I think I get asked a lot now for advice or, from interns and others that we have here. And I took the initiative. I didn't wait around to be asked. And I just helped out. I did everything from picking customers up at the airport, taking them to Mall of America, various other things during the week around the company. So then I learned. I was learning the company, and then I started building relationships with Starkey's customer base. And because they were doing a lot of classes here on campus, and those relationships were key, because this wasn't my goal or dream or anything close to that. I wasn't going to be in hearing aids. No way. I wanted to be an astronaut growing up as a kid, right? That was the next frontier.
Or baseball, one of us.
Baseball, yes. I was heavily in baseball, lifelong Cubs fan, so I was going to go up to Wrigley Field. But I just kept working and working, and I gained experience. And failure was my biggest teacher. And Starkey, allowed me to do that, make mistakes, and which I focus on today is it's okay to make mistakes, learn from them. And so I went in sales, working more with customers, and just various roles throughout the company in the customer facing, and just try to simplify and really focus on our mission statement, which is, serve our customers better than anyone else, because you have to have the product, but it's a relationship business.
Yeah, I was a marketing guy in another life, and you sit behind the scenes in that kind of role, and you look at landscapes, and you do things to influence markets or influence decision making, whatever. And you're not the face of the customer. Sometimes you'll get an email back, but that usually goes to sales or somebody in account management or something. And it was always such an eye-opening experience when you stepped in front of the customer, or you were repairing a hearing aid, you knew the product, you touched it, you felt it, you experienced what that customer felt like. I imagine you did, because you repaired something, they were happy with it. I think there's so many of us in corporate world, especially, that don't ever touch that customer, and it is such a it can be such a foundational and such a pivotal experience, I think, in people's lives, because it gives you just such a different perspective.
It's a missed opportunity.
Oh, it is. And so if you're in a corporate job, go touch the customer. Go figure out how you can get in front of the customer with a sales team or a repair truck, or or somebody, just to see their experience with your product, because it's just it's such a mind-blowing experience, because it is so transformational. Well, at least it was for me.
And it's the littlest things too, because I'm very self-aware that I don't want to be insulated from what the customers are saying, or our employees, the team. So our classes we have up here, I go to other events or conventions or customers' offices and talk to them. And you reply to an email, like you mentioned. I get some emails and I'll reply direct, or a patient will send a letter, asking a question, or this product hasn't worked for me, and I'll call them, and it makes all the difference, and they remember it.
Well, you guys are sitting at a very interesting intersection right now. You've got an aging population. I think we talked to a few folks that are in this market. One of our overall winner in the Big Innovation Awards this year was Alcon, and they developed a machine that did eye surgery faster, better, cheaper. And it's this market that's really growing, this aging population, especially in the United States and other European countries, a lot of Asia, where there's this growing boom in the need for this stuff. You also have a very rich environment for investment in technology, and some amazing technologies, especially coming out of the United States, other places of the world. How is that kind of impacting your roadmap, and as you navigate this new kind of politically uncertain world, how are you navigating all of this kind of good and bad?
Yeah, in the U.S., there's around 45 million people that have hearing loss. Globally, 480. Aging population. And, my focus, around the hearing healthcare and hearing technology is, first we have to get back to the basics, and the messaging is, hearing is essential. It connects people to people. And usually the stigma around getting hearing help has been, from old ads, media, TV, movies, really stereotyping a hearing aid. Whistling, or what do you first think of if you need a hearing aid? Most people are going to say, I'm old, right? And it's a superpower. I mean, that's the way I look at it today, and that's what Starkey has been driving towards, is a multifunctional device, not just a singular, amplifier that's going to amplify noise. You can get those type of cheaper products, poor quality, because they're going to amplify everything. What we're doing is making complex simple, where we have to put, there's 310 components in here, and it's lithium-ion rechargeable, Bluetooth radio. It's industry best processing and circuit technology, and it's a little computer. It's your personal assistant. So what we look at, and what I set out for Starkey is, we want the best hearing aid. We want to be the best, and not the largest market share. Don't focus on revenue. To me, that's just table stakes in what you do in business. Let's be the best at what we do, and how can we reinvent it? And it starts with hearing and noise. People need help hearing and noise. So it's starting to change the mindset of, it's not just a hearing aid, it is that personal assistant that's going to help you do just a little bit better every day in your life. It's going to give you that edge. Doesn't matter if you're 70 or 80 or you're 50. If you're working, family, whatever it might be, you want to be just a little bit better. And there's different types of hearing losses and different makes and models for what we could do. But we were changing the conversation on that hearing healthcare, because, as you mentioned, yes, aging population. You have your your pretty much traditional patient that's goes into the office and is in that that baby boomer generation, and then you've got the digital patient that's coming in, right? Everything is on their phone or iPad. So we're adapting to both types of patient to serve them better as more and more people move into that hearing loss age. Right now, 1 in 6 teenagers have a hearing loss.
Oh.
It's no pun intended, but it's a silent pandemic because of AirPods and all the noise, and once you lose your hearing, you can't get it back. So
Well, that's really not good. I mean, the
No.
number before, you had about 12% of Americans, of all
Yeah.
Americans, right? Roughly, I'm not sure if my math's right. 15%, right? You said
Yeah.
40 something million
Yeah.
of
45 million.
and now you're talking about 1 in 6 kids.
Right. Yeah. And it's nothing. So it's nothing we're proud of, or I'm sitting here like, oh boy, business is going to be good. Starkey then also is having initiative and products helping protect healthy hearing with our sound gear products. And so we don't want hearing loss. We'll serve those that do, but it's also educating on the importance of hearing and protecting the hearing you have.
Now, you guys have put all those 300 components into that little tiny box or tiny pod. And now the innovation that you were awarded with was now you've brought AI into the mix. So you've launched this Omega AI last year. Tell us, give us a little bit of background of how you got there and kind of the problem it's solving.
Back in 2017, we were at a point where needed a game changer. I like taking risks. I like being bold. I like to shake things up. And in our industry, since it's somewhat small, people do jump around to company, and you could hire executives and people with institutional knowledge, but you're going to get the same thinking. That's where I was, and I need a new chief technology officer, and kind of started remodeling and redefining Starkey. And so I went outside of the industry. I started a search for 400. Of course, they come back with all this list, and there was one name on there, and they said, this guy is at Intel. He reports to the CEO. They're on the AI revolution. They're working on technology there. He's not interested in leaving me to be a good fit. I said, no, I want to talk to him. That's the one I want to talk to. The one they tell me not to. And called him up and hired him, Dr. Achenbomic, who's still here, and we work closely together. And we started, what can we do with AI, with hearing and hearing technology, in order for the product to be helping others hear better and sifting out noise from what you want to listen to. So we came out with the first hearing aid with AI, hearing technology, back in 2018, and we're on our fifth generation, and it's gotten better each time. And we've been leading in AI technology and what we can do with the products when we launched our Omega AI product last October, and it is the industry-leading technology. It's the best
I
one.
think it's super interesting because you guys are mimicking the human brain with a neural network. So if people don't understand that, good, because I'm sure I'm right there with you, but I know that the neural networks are super important in AI. Google's built this huge neural network with chips. So tell us what that means in the Starkey world.
Well, I won't even say I'll dumb it down, because this is how I explain it, and I understand it because I have 800 people that are really good at talking at that high level or getting it done. But think of it as, again, I'm listening to you, and with hearing loss, think of it, it's scanning, and it knows, the product knows that I'm talking to you. I could program it to whatever setting if I'm want to hear more direct speech, if I want to hear if I'm in a crowded noise. It adapts to my environment. And what we do is, with our deep neural networking, and think of it like you have there's tiny little holes in the processing of your hearing, and we're filling those holes in based on the environment and what you're asking the product to do for you. So AI has helped us, again, quicker processing, better listening, easy listening efforts, and then again filtering out where, our new Omega AI with DNN processing and working, mimicking the brain. I call it the 3D surround sound effect, right? Where if I'm talking with you and I know that I think right now, and I could hear my fan right above me, it's allowing me to choose what I want to listen to, instead of, if I'm talking to you, then the fan would be, overcoming the sound of our conversation. And if I hear a noise out in the hall, I, directionally, I can understand, or I immediately know where it's coming from. And in the past, again, think of it just like a flat line. You would just be hearing a lot of everything, and trying to locate where the sound was coming from was very difficult for people 10, 15 years ago. So
Have
we're
there
bringing
have
3D
have there
hearing.
been have there been studies done on people who, like, I have a challenge, difficulty processing audio. And so especially when there's complex audio, meaning multiple sources of audio coming kind of at me. So not a party so much where there's a roar, that's okay, or a stadium. But if I have a dog barking, a doorbell being rung, and somebody asking me a question, usually, three things or more, brain shuts down, panic ensues.
Well,
And it's a learning difference for me that I know I have, and I do certain things. But what you just described to me sounds glorious. It's from a different standpoint of being able to be in a room and going like, oh, let me just talk to Brandon, and
Right.
kind of push everybody else
And
out.
I know it sounds too good to be true. Here's a CEO pushing his product, how great they are. I'm the type, and I think one of the, with our customers, I have the respect and integrity in the industry. If it's not good, I'm going to say it. I mean, I could get up in front of, 300, 3,000 of our customers and say, we have the best, because I know what we're doing. Our competition's good. I respect our competition, but competition in business, it should drive you. It drives me, it motivates me. I guess that goes back to my sports days and stuff, because I want to be better, want to be the best, and I'm always pushing Starkey to do more, not work harder, but where do we need to focus for the impact?
Yeah. Well, you guys have also added some of those other health features into the product too, which, I mean, if you have access to ear canals and blood vessels, you can do some other cool things. So tell us about kind of the other stuff that you added, because it all goes hand in hand with, it's kind of a whole body approach.
Correct. So it's really, think of it in three channels. We have better hearing, so that's the hearing aid component I just described. Then we have our healthable health features. So it's an overall wellness. So we have features that, think of it like the ear's the new wrist. Step counting. One of the features for a certain demographic that we incorporated, and we're the only ones that haven't and continue to, is our fall detection. So obviously we all know there's a high risk in falls as we age, and our product, if it's activated, they choose so, they could text, set it up to text 3 individuals, and if there's a fall, somebody falls, the hearing aid will detect the fall and text their loved ones that a fall's been detected, so they could check on them. I've had numerous stories of people saved their lives. Somebody was a veteran.
I had this happen to my mom last year, and if you think a fall is a broken hip, wait until they hit their head.
Right.
It is a serious deal.
And I remember, there's always discussion when you're putting in features and trying something. People aren't going to use this. How many people are, is this worth the time for the number of people? One, exactly. That's what I said.
One.
If we help one person, it's worth it. And we've saved numerous people's lives. I mean, I've received the letters, the calls. And so, we're always pushing what we can do and what people will use and what's relatable. I don't, because I didn't want to be seen as like we're being gimmicky, like a mood ring. I want something that valuable and that people can use and choose to. They have an option to. The third is, our AI personal assistant. As I mentioned earlier, I'm with my son who's now 19, but I've seen every Marvel movie. And so the way I liken this is it's going to be the Jarvis in your ear. And that's where, we're taking it. Because right now we can translate 72 languages. I could tap and ask, what's the weather? What's the temperature outside? 10 degrees. So it's it's, again, you have to start somewhere. And it might, sound, oh, I've heard it all. We don't need all this stuff. You got to start somewhere. And what we're finding out, starting somewhere is working pretty well for us.
Yeah, you have to figure out what's working and what the customer
That's how you
wants
innovate.
or
Right.
what they're going to accept. It's interesting because I imagine you have to balance this care and innovation cycle speed,
Yeah.
algorithm
Yes.
pretty closely because you want to jam new features, new tech, quick, get to market, but then you do have this care element that's a little slower in cycle. How do you balance that, kind of in your innovation cycles?
Well, it's, one thing that I outlined for the company, 10 years ago and been, consistent on is taking risk and being innovative. Not just following, because in our industry, it was just incremental improvements about every 18 months from everybody. You call it, it's a small tweak, and then any company, including Starkey, you'd have a big campaign around just incremental improvements. And, I like to swing for the fences. So, like I mentioned, redefining a hearing aid, hiring the right CTO, having a great talent here. And, now as we say, Starkey's, setting the speed of innovation in our industry, and we do have to watch it. You want to come out with new things, but we want to come out with what's going to be of value, and it's the right thing to do at the right time. So what used to be, every 18 months, has been about every year now. But, I know what's coming over the next, 4 or 5 years, and it's pretty incredible. It's hard not to want to push more out sooner. But, we're as far as what technology allows us today. And then balancing that, it's the experience of me knowing the industry, the patient, and the team. Not just myself, but everybody that's at Starkey and making those decisions. Out of all the companies, we have the most experienced executives and directors and people here in our R&D of audiologists and that just know the industry and what's right for the patient. Being privately held, we do what's right for the patient. That's the priority one. Priority two is the customer. Priority three is Starkey. It's not the analyst. It's not the stockholder. It's not the board. So that's part of Starkey's secret sauce is being privately held where we can be agile, move quick, and do what's right.
Yeah, it is a value. The corporations do spend a lot of time, trying to add
Yeah.
shareholder value, and a lot of that, as we've seen,
Yeah.
is not always in the best interest of customers. You think it is.
Yeah.
I think, I've been in those meetings, and you tell yourself it is.
No, it is. Well, it is, and that's just business. Some of them that's what they have to do, of course. And one thing that I'm always, asking the question, but we will not sacrifice quality for cost. I've been in meetings
Right.
like, well, okay, we'll save here, but what's that do to the performance or the quality and reliability? We'll not sacrifice quality for cost.
Yeah, and I know everybody puts Steve Jobs on a pedestal, but he was a big advocate of that. It's you're doing this for the customer. The customer has to feel the quality, understand it. Make their life better. If you're
Right.
if that's not your goal, then you're in business for the wrong reason.
Exactly.
And you won't be
If
number
we're-
one. You definitely will not be number one.
Right, and that's where I get to, well, what's our goals? And if you chase money, that's what you're going to be doing. You're going to be making poor decisions. So again, going back to the patient, it's making the right vision for the company, be the best, and doing what's right for the patient, and then everything else is going to follow. And we're fortunate that right now that's the way it is. We had our Starkey's record year in 2025.
Yeah, well, congratulations on that. You guys are definitely innovating in the field. And you mentioned something earlier, your Starkey Cares program. You guys follow it up with a lot of community-based kind of support and also kind of supportive education. Tell us a little bit about that initiative.
Yeah, our core value is caring, and that's really was started by our owner and founder Bill Austin. When he started selling hearing aids here in the Twin Cities in 1961, February 10th. So next week is our Founders Day. 65 years. He was doing that, working for his uncle to pay for college at 19. And the first appointment that he went on was an older gentleman, bad hearing loss, and he wanted the product, but he didn't have the money. So Mr. Austin gave it to him for free. His very first appointment, he paid for it. So that mindset and how he approaches, business and humanity, I've learned a lot from myself, and it's really, the type of company we are, where we're helping other organizations. We want to be a strong local community citizen, good corporate citizen. We want to help others that need hearing but don't have access or can't afford it. So we give hearing aids, the best ones, away every year here in the U.S. We partner with the Starkey Hearing Foundation, who gives away, has given away millions upon millions of hearing aids around the world to people that can't afford it. So philanthropy and caring and giving and just a random, kindness, random acts of kindness and being kind to people is what, is it within our foundation and what I talk to our employees about. Because it's also how we hire. I have the philosophy is, hire for attitude, develop the talent. I want caring attitudes, people that understand and want to be here and care about what they're doing. Because you can develop talent, but you can't develop a bad attitude. Fix a bad attitude. No. So it permeates the company. And as I said, I don't like the hierarchy type approach. We work as a team. There is structure. You have to have that. But it really is, a team approach. And when I talk about the Starkey family, a lot has to do with, want people to want to be here on campus, proud of what they do. And again, they know that through our Starkey Cares and other initiatives, the work they do matters to the patients and the customers we serve, but we're also providing products and, better hearing to people that would not be able to have that opportunity.
Yeah, I know it's such an important thing you're doing. Hearing is just as important as vision. And we get glasses, so let's not be afraid of going and getting hearing aids if you have hearing loss, and let's help people out. We help people out with glasses. I'm glad you guys are doing this. What a great initiative. So now you're my ear guy now. I have Frank over at Alcon, who's head of R&D at Alcon, as my eye guy. I can't imagine a better eye guy. So now I can't imagine a better ear guy. If somebody's listening and thinks they might have early signs of hearing loss, what does that look like, and what do they go do?
They probably, their spouse is going to notice it first, or significant other. We know that, right? And we've all been asked those questions. Usually it takes about 7 years from somebody to, I think I have a hearing loss, to want to do something about it. And we're shortening that journey because of that stigma and educating people in the public on today's technology. You go to starkey.com. We have the information. You take an online test, but it's best to find a professional in your town or community. We have a location finder on our website. Put in where you live, and it'll direct you to one of our customers' locations.
Yeah, and I wasn't kidding. As somebody who I had ear problems, the ear tests are not a big deal either.
No, it takes, not even 30 minutes. It's just the look inside your ear, make sure the ear canal and everything's healthy. You're not plugged up with wax, because sometimes it can be plugged up, and that's causing some hearing loss. But it's a quick test, and then you just get educated on what your options for solution.
Yeah. Well, I encourage everybody to go do it. Especially as you age. I love the fall component to it. I love the other stuff that I know you're going to put into it is coming. There's obvious stuff that needs to go in that, and it sounds like you guys are headed that way. So, congratulations again, Brandon. This is super interesting now that I have an ear guy.
I'm your guy.
I'll find some other people to help me with my health, but really appreciate the conversation. Great to catch up with you and about your technology and the overall industry. So thank you.
Thank you, Russ. I appreciate being on here and sharing it.